All right, here we go. Hello, everyone. My name is Dr. Marty Kotler. Thank you for watching this webinar on telehealth, record keeping, compliance, and documentation. Now, the information that I'm going to be sharing with you is in response to many doctors of chiropractic reaching out to us here at Target Coding for assistance and guidance on telehealth due to the COVID-19 outbreak. So it's a little challenging, right? Some doctors are saying, well, can you adjust a patient through the phone? Of course not. Chiropractic is a very hands-on profession. So how could we utilize our services through telehealth? Well, I'll show you in a few minutes. All right, so here's my disclaimer. This webinar is not supposed to substitute your current clinical protocols. This webinar is not supposed to substitute your billing and coding protocols. This is not legal advice. Target Coding does not provide legal services. I've made every attempt to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Again, my name is Dr. Marty Kotler. I'm a chiropractor. I practiced for many years, 16 years, prior to starting my company, Target Coding. I'm also a certified professional compliance officer, certified billing and coding specialist, and I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So you'll see during this presentation how I combine the two to make things very simple and practical. You could take a look at a regulation or a rule and go, I don't understand this. It's very complicated. What I'll do is I'll look at it, I'll make it sound very simple, and that's what I'm going to do today. A lot of these things have these formal definitions. I'm going to make it very simple and practical for you to understand in a very nice, calm approach. When I do my seminars on coding and compliance, a lot of the webinar attendees and seminar attendees, they get concerned that I'm going to scare them. I don't scare people. I just teach you what's going on out there, and then you decide what you want to do. So we've been helping thousands of chiropractors and staff members for the last 14 years with compliance as it relates to billing, coding, documentation, Medicare, HIPAA. Now, another thing I want to share with you, this webinar is not about making money. You don't have to do telehealth at all. If you want to do telehealth, you don't have to charge for it. You could do it for free. You can charge cash. You could bill insurance. You don't have to, you got to do it across the board compliantly. You'll see during this webinar, a lot of the compliance rules that we teach here at Target Coding are relaxed. There's about 3 or 4 things that are relaxed now due to the coronavirus outbreak, but that you would not do during normal times. So, but there are other things that you have to do compliantly, even though there's the COVID-19 outbreak going on. So again, you don't have to do telehealth at all. You want to do it for free? My recommendation is stay in touch with your patients. I'm going to go over that a little bit later, why it's important to stay in touch with your patients, even if you're not going to do telehealth. So again, you don't have to charge, but it's got to be the same across the board. You can charge, you can bill insurance. Maybe you want to try these things out, document everything you do. I'll show you exactly what you need to document. Hold on to the claims. Maybe you want to wait for the dust to settle and then submit your claims. All right, so here's some CE instructions. This webinar has been approved for 1 CE credit in many states. Of that opening slide were all the states that this has been approved in. But if you want CE credits, there's a processing fee. It's a $99 processing fee. So if you want CE credits, fill out the form, get us your NPI number, your license numbers, all that information, answer the 5 questions that I will be asking. I'm going to be asking 5 true and false questions. If you don't plan on getting CE credits, then don't bother answering the questions. Do not, at the last webinar I did, a few of the attendees were answering the questions in the chat box. Don't do that. Do not answer the questions in the chat box. You'll see how you'll be able to answer the questions in a few minutes. You'll just click on a little button to answer true or false in the 5 questions. But if you have no interest in getting CE credits, then don't bother answering the questions. You can if you want to. Now, if you're a CA, then you would like a certificate of attendance. Even the doctors listening to this, if you would like a certificate of attendance that you could put in your billing and coding compliance manual that you attended a webinar, we'll supply that to you. If you're an office manager, a billing office manager, or the office compliance officer, I strongly recommend you get a certificate of attendance that you came to this target coding webinar. We have a timestamp as when you logged in and logged out. So we'll get that to you if you would like. Any questions regarding CE credits, just send an email to info@targetcoding.com. Okay, so here we go. Telehealth, record keeping, compliance, then documentation. So telehealth refers to the exchange of information from one site to another through electronic communication means. Telehealth has gotten very popular now because of this coronavirus outbreak. What's nice about it, it allows more patients to access care. So telehealth means that you could see the patient, they could see you, they could hear you, and you could hear them. This is a live video conference that gets initiated by the patient. All of this is going on because of this public health emergency. An act has been created. The federal government has created the Coronavirus Preparedness and Response Supplemental Appropriations Act. If you are the billing manager in the office, you should be familiar with that act. One of the things that that act does is allows certain waivers to be included under the Medicare Social Security Act, Section 1135. So again, office managers, compliance officers, pay very close attention to that. Now, there are many types of visits that are associated with telehealth, but there's only one group of telehealth visits, and then we have e-visits, which is not telehealth. We have virtual check-ins, telephone services, that's not telehealth. And there's interprofessional telephone consultations. So I've been attending a lot of other webinars on telehealth billing and coding. So I am including in this webinar just about anything, any code that has to do with dealing with a patient that's not coming into your office. That includes telephone calls. All right, first things first, you have to find out if your state allows you to do telehealth. There are some restrictions in certain states. I heard there's one state that doesn't allow telehealth. I'm not going to mention it because I don't know if the resource was that reliable. But first things first, contact your state board, find out if telehealth is within your scope. Let's assume it is. You want more information? This is a great link, right? I'm going to be giving you a lot of references, a lot of links, a lot of resources. Here's the first one, cchpca.org. Great website, goes through every state, what they can do, what they can't do. Okay, so telehealth visits. Again, this is an interaction between you and a patient through either your computer or maybe your phone. It's a little tight to see it well through your little 2-inch screen on your phone. So I'm going to recommend, if you're going to do telehealth, do it through a nice large 20-inch desktop screen monitor, or a nice large iPad or Surface, so you could see what's going on. But you can use your phone if you want. I just think it's a little small. So if you're going to do this, you need to realize that this is an encounter that has some HIPAA risks because you're doing it through a phone or a computer, right? So patients should be notified, and they should sign your telehealth informed consent form before you do this telehealth visit, if it's possible to get that signed. There's a few ways I'll explain later how you can get it signed prior to this initial visit or this initial telehealth visit, right? Because this should be a established patient. Contact your malpractice insurance company. They'll give you an informed consent form. If you do not have malpractice insurance, contact us here at Target Coding. We'll send you our sample. Target Coding members, you know that's included with your membership. We'll send you the informed consent form. So this should be an established patient. Could it be a new patient? We have a whole bunch of questions that have come in over the past month regarding telehealth. I've kept a log of all these questions. We have a whole bunch of FAQs we're going to be releasing. I think we have about 60 FAQ questions. So one of the first questions that are coming in is, Dr. Collar, you always say that these are for established patients. Could we do it on a new patient? The answer is yes. Here's the first rule that has been relaxed by the federal government. You can do it on a new patient. Now, I'm not telling you should not be advertising this, taking out full page ads in the newspaper. Hey, come on in, we do tele. No, you're not trying to attract new patients. That's not the purpose of this. The purpose of this is to help your existing patients, keeping them out of the emergency room. I mean, that's, one of my clients brought that up to me. He's like, Dr. Collar, I'm going to do telehealth because I'm in New York. It's a hot spot for COVID-19. The emergency rooms are packed, overwhelmed. If a patient has severe back pain, if they could do a telehealth visit with me, there's a chance I can keep him out of the ER. That's a tremendous service to your community. And you know what? I forgot who told me this. The number one reason that people go to the emergency rooms under normal times is back pain. I was surprised to hear that. So it could be on a new patient. Now, here's another thing that's relaxed. Number 2, can you use FaceTime, Zoom, Skype to do a telehealth visit right now? Yes. Prior to this COVID-19 health emergency? No. If a client of mine called me and said, hey, Dr. Collar, I want to do a telehealth visit with a patient of mine through FaceTime or Zoom or Skype, I would say no. Get the HIPAA secure version. But now, over the next couple of weeks, you could use your phone to do it. Do not use Facebook Live. Do not use TikTok. So you have a telehealth visit, a live video conference call with a patient. And what are you talking about? They have pain, they have discomfort. You want to give recommendations. I'm going to show you the checklist later as to what the things can talk about. So you're going to document based on what? Counseling and coordinating care. That's what it's about. Counseling and coordinating care. It's based on decision making, where time becomes the overriding factor. So what you're going to do is you're going to use your regular E&M codes. For example, a 99212. You're going to get paid the same. You should get paid the same. We're going to go over that a little bit later too. So whatever you're doing right now in your office regarding 99212, you bill that, okay? You're getting paid X number of dollars from whatever insurance company, same thing here. You could do it without the patient coming into the office. You're not adjusting the patient through the phone. Make sure you write down the amount of time you spend speaking to the patient, because all of the telehealth services, all of them, are based on time. Number 3, waiver. The federal government is saying, oh wait, we didn't get to number 3. We're still on number 2. So the FaceTime, the Zoom, the Skype, under normal circumstances, you would do a normal risk assessment, right? You don't just use a company that's going to have access to your patient data. This is HIPAA, HIPAA, HIPAA. By the way, every single one of you listening to this presentation, you're required to have a HIPAA compliance plan in your practice. Even prior to the COVID-19 pandemic. All 50 states in the country, every single chiropractic practice in the country, every single one of you listening to this, you're required, it's mandatory that you have a HIPAA billing and coding compliance manual with policies and procedures. I would say 50% of you listening to this do not have one. You're risking, especially now, penalties, starting at $50,000. But here's one you won't get penalized if you use Zoom or Skype. They're saying it's okay. Once this is over, in a couple of months, I don't know when, whenever this is over, stop using FaceTime, Zoom, Skype, or else you could face HIPAA fines starting at 50,000. So what I've been telling my clients is start with a HIPAA secure Zoom, Skype, FaceTime, like Zoom for Healthcare, Doxy.me. These are HIPAA compliant platforms that you'll get a BAA signed. Right now, if you wanted to do a consultation with a patient through FaceTime, you don't need a BAA, but it's temporary. So there's the link there for more information. So here's the third relaxed rule. What was the first relaxed rule? You could use it on a new patient. The second one, you could use a non-HIPAA compliant platform like FaceTime temporarily. Number three, if you're going to do telehealth and you're going to bill patients' insurance, federal government is saying you don't have to collect the copay if you don't want to. If you want to, you can. Go right ahead. You don't have to. But remember, even though there are certain rules that have been relaxed, you still have to abide by basic logical compliance rules. So here's one. If you're going to charge patients their copays on telehealth, charge all of your patients' copays. You can't pick and choose. Oh, just the police officers, I'll waive the copay, but all the teachers, they have to pay, or Aetna will waive the copay, but United, no, no, no. You have to still abide by basic compliance rules. It's got to be the same across the board. So this is nice. If you're going to bill insurance companies for telehealth, you don't have to collect the copay. Next, under the 1135 waiver, you want to provide care across state lines. So you're licensed in, let's say, New York, and you have a patient that calls you from Colorado. Can you provide health care through the phone and give a patient a diagnosis? They're in another state. You're not licensed in Colorado. Can you do that? Under the 1135 waiver, certain healthcare professionals can do it. Check with your state board before you do that. And there's other scenarios that we're going to go over later. You know, like where are you located? That has to be in the notes. Let's say let's say you're located in Missouri. You have a practice in Missouri, and you've left Missouri to be with family in Indiana. And now you're going to do telehealth from Indiana, where you're located. You're not licensed in Indiana. You're only licensed in Missouri. Can you be sitting in your aunt's house in Indiana and doing telehealth if you're not licensed in Indiana? And what happens if you do that? And now your patient is not in Missouri. You're licensed in Missouri, but the patient has left Missouri and they're in Nevada with their family. And now you're talking to a patient in Nevada. You're not licensed in Nevada. This is one of your patients, and you're not. See, we're going to go over that in a few minutes. Now you're allowed to tell patients that you offer telehealth. My wife just got this email from her eye doctor. I liked it, so I'm showing it to everybody. This was an email just letting all their patients know they're offering telehealth. Currently available, HIPAA compliant, no need to download, access from your desktop, tablet, smartphone, simple, safe, secure. I love it. Call, make an appointment. I just got a text from my dentist. Hi, patient Marty. We are offering teledentistry. Text us back or call us to make an appointment. I don't know what they're going to be able to do. I don't think you can do root canal, right? You can't do root canal over the phone. But there's things that could be done, I'm assuming. Here's question number one. During the COVID public health emergency, CMS is waiving the HIPAA restrictions when using platforms such as Face, Zoom, and Skype. A, true, B, false. Here we go. I'm going to launch it. You should see it on your screen right now. A, true, B, false. A lot of people on the line this morning, so I have to wait about 15 seconds for everybody to answer. Okay, I think we got everybody. Oh, let's go to question number 2. During the COVID-19 public health emergency, CMS is allowing providers, if they like, to waive copays and deductibles. A, true, B, false. During the COVID-19 public health emergency, CMS is allowing providers to waive copays and deductibles. A, true, B, false. Okay, let's move on to e-visits. These are for established patients. You need to use an online patient portal. An online patient portal is a secure site. It's through your software program. So if you don't have software, forget it. You cannot use e-visits. Just plain out simple. If you don't have software, you cannot bill for e-visits. If you have software like Genesis chiropractic software, it includes an online patient portal. Some of them are very robust, some are very simple, but this is an online patient portal where a patient can communicate with you through this online patient portal through your certified software program. Patient creates a username and password. They could email you, you could email them. Some of them are very robust. Like I say, appointments could be made. You could pay bills. Patients could pay bills through this portal. There could be tracking of their fitness and activities. Some of them allow video visits. So the patient contacts you through this portal, and then you email them back, and you go back and forth. Find out if your software company allows this, or if you even want to use this. So these are e-visits are time-based. 99421. E&M online cumulative during the 7 days, 5 to 10 minutes. 99422. 11 to 20 minutes. 99423, 21 or more minutes. Now, for non-physician providers, the most common non-physician provider in the chiropractic world is a physical therapist. I work with many doctors that employ physical therapists. Now, you might not be able to in your state. For example, in New York, chiropractors are not allowed to employ PTs, but can co-own a corporation with a PT. That's nice. In New Jersey, chiropractors could employ PTs. Some states you can, some states you can't. So those of you that employ physical therapists and you're billing Medicare, here are the codes. These are also for occupational therapists, speech language pathologists, clinical psychologists. They're HCPCS codes. These are Medicare specific. Some regular insurance companies follow CMS policy, so maybe some of them will also pay for these. G2061, 5 to 10 minutes, 2062, 11 to 20, 2063, 21 or more. The questions that are coming in on these from our integrated practices, do we need to use the GP and the CR modifiers? Physical therapists? Yes, probably. As of today, yes. A few days ago, it was no. Will it count towards the annual therapy dollar cap? The answer today is yes. Okay, so these are non-Medicare or CMS-based insurance companies that will pay physical therapists, clinical psychologists, speech language pathologists, occupational therapists for your basic CPT codes, 98070, 5 to 10 minutes, 71, 11 to 20, 98972, 21 or more minutes. You see, these are all timed. And these are newly released codes by Medicare saying, we'll cover these also. Whoa, they just added these, I don't know, about a week ago. So you got your PT, OT, SLP, evals, but then look at that fourth line down, 97110. A lot of chiropractors use 97110. So I'm going to show you in a few minutes how to incorporate that into your telehealth. When I first saw this, I was like, oh, is this just for PTs? Wait a second. Many, many chiropractors will be able to get paid for those codes if Medicare covers them. not to chiropractors seeing Medicare patients. Also, here's a little reminder, office managers, billing managers, compliance officers, please, please do not put all your Medicare patients into one bucket. I find that mistake all the time. Natasha, Brandy, John, all of our consultants, they always come back and say, Dr. Kotler, why do so many chiropractors and their billing off the managers put all Medicare patients into one bucket? You have to stop that. Medicare Part B pays chiropractors for spinal manipulation only. So if you're in Texas, Colorado, New Jersey, it's Novitas, right? That's the Medicare Part B carrier. Millions and millions of patients have opted out of Medicare Part B, and they've gone into a Medicare Advantage plan. That's also known as Part C. C as in cat. Those plans are different. Many of those plans will pay for more than just spinal manipulation. So please understand there's a lot going on here. And office managers, billing managers, please take this very seriously. There's a lot here. Here's another thing that people are confused. Dr. Kotler, are e-visits telehealth? No, e-visits are not telehealth. People are getting confused with this. And Dr. Kotler, should we call it telehealth, telemedicine, telechiropractic, telechiro, telerehab? I'm seeing all these names. My recommendation is call it telehealth, period. It's a all-encompassing, broader scope term. Some states will not allow you to say you offer telemedicine. Careful with that. So there's some more information about why e-visits is not considered telehealth. And now we have virtual check-ins. This is different. A virtual check-in does not require a computer. You could use a computer. The first two e-visits, you had to do a computer. This one, no, you could use a telephone. So rules are a little relaxed. When you're using telehealth, a computer, phone, you can see the patient, they can see you. That's a type of synchronous exchange. You're going to hear the term synchronous. If you are a billing manager, office compliance officer, you're going to see this term a lot. Become familiar with this, office managers. Synchronous, asynchronous. Going to go over the definition in a minute. So virtual check-ins, again, you have to document the amount of time when you create this virtual check-in with a patient. You have to get them to verbally say, I agree, I consent to receive this service. You should do that across the board. And here's the code, G2012, 5 to 10 minutes. Getting a lot of questions on the 2010. What's that? That's different. This is where a patient is sending you information via email, maybe their x-rays or MRI reports, you're looking at them, and then you're getting back to the patient. Back and forth, that's called store and forward. That's 2010. All right, let's go to question number 3. Documentation should include the amount of time you spend speaking to the patient. A, true, B, false. Okay, yeah, so I mentioned asynchronous and synchronous. All right, here we have the American Telemedicine Association. Until a month ago, I never heard of this association. I didn't know it existed. I went to the website. I find it very interesting. This is the stuff that interests me. I am unfortunate, due to this, there's a silver lining in every cloud. This has been a very interesting learning curve for me, learning how to bill for telehealth. And I can tell you, I'm enjoying it. I feel like I've become a 10th degree black belt in telehealth, compliance, billing, and coding. And I could tell you this too. Many of the doctors that I'm working with, especially my New York clients who have had to close their offices, they're saying, Dr. Marty, even after this crisis is over, I am going to assign one of my doctors, associate chiropractors, to do telehealth, even after this is all over. So get familiar with this. The American Telemedicine Association, I'm going to become a member. I'm really going to get involved with telehealth because everybody's telling me it's the future. You know what? It's not the future. It's here. It's now. A friend of mine went to a friend of mine just yesterday. He had an appointment with his medical doctor. He goes to the office. The receptionist says, "What are you doing here?" He's like, I had an appointment. They said, "It's a telehealth. Go home." And he had the consultation through his computer. The doctor, same code, same fee, as if it was in person. So the ATA describes asynchronous as data takes place over time. Yes. ONC says synchronous is live video conferencing. So here, let me just narrow it down. Keep it simple. Synchronous, live, telephone, audio. Asynchronous, email back and forth, text back and forth, fax back and forth. Let's go over consultations through the phone. 99441. Telephone. You don't need a computer for this, just your phone. Telephone E&M service provided by a healthcare professional who could report E&M services to an established patient, parent, or guardian. Billing managers, listen to this definition. This is important. If you're going to be billing out for the doctor that you work for, please understand this language. Established patient, parent, guardian, not originating from a related E&M service that was provided within the previous 7 days, nor leading up to an E&M service within the next 24 hours or soonest available appointment. 5 to 10 minutes. 99442, 11 to 20, 99443, 21 to 30. So you see how these are based on time? Also, doctors and billing managers, if you are in New York, this is New York only. I repeat, New York only. 99441, workers' comp and no fault. That's the code to bill. Now we have 99446, interprofessional, internet, EHR, service, consulted, 5 to 10 minutes, 99447, 11 to 20, 99448, 21 to 30, 99449, 31 or more. Now, we're training our clients to not block off more than 15 minutes per visit. You know, you could have some patients that might want to do a Zoom conference call with you for an hour or 2 hours. I don't recommend that. We're putting together protocols on all of this. Coming soon. Okay, just had to hit the cough button. All right, 99451, interprofessional, telephone, internet, EHR, and management services provided by a consultant, including a written report to the patient's treating or requesting provider. 5 or more minutes. 99452. Interprofessional telephone or internet or electronic health record referral service or services provided by the treating provider, 30 minutes. Now we have telephone consultations that could be performed by non-doctors. So these do not apply to chiropractors. If you're a chiropractor, do not use these unless an insurance company has specifically told you to. So these would be used by physical therapists or occupational therapists. I went over the list earlier. 98966, 5 or 10 minutes. 98967, 11 to 20, 98968, 21 to 30. So as of just a couple of days ago, these are going to be covered by Medicare for physical therapists. That's good news for the PTs. If you're an integrated practice, very good news. These were not originally included. These were not on the original list. Still use the GP modifier. Okay, now we're going to get into coding, modifiers. Let's start with the modifiers. 95, don't confuse that with 59. Everybody knows 59, right? Here we have 95. Billing managers, you've probably never used the 95 modifier. Get used to it if you're going to be billing telehealth. It means synchronous telemedicine service rendered via real-time, interactive audio and video telecommunication system. CR, this is kind of sad. This modifier CR means the service that you rendered is related to a catastrophe or disaster. GQ, via asynchronous telecommunication systems. Some plans want you to bill this, most don't require it. But this was around prior to the coronavirus outbreak. This is part of a federal telemedicine demonstration project going on for providers in Hawaii and Alaska right now. GT, via interactive audio and video telecommunication system billed under the COB method too. Most of you are probably not familiar with that, the COB method. That's for critical access hospitals. Now, some payers will reimburse based on Appendix P. Billing managers listening to this, when was the last time you looked at Appendix P? Until a month ago? I haven't looked at Appendix P probably since when I went through my certifications in coding and billing 10 years ago. Appendix P, go check it out. Appendix P lists the CPT codes that could be used for telehealth. Then we have box 24B, place of service codes. There's about 70 different place of service codes. You're used to one, right? The number 11, box 24B. Number 11 is the office. Well, the number 2 means telehealth. Number 12 means home. We have some clients that go to the patient's place of employment. I think that's number 18. There are place of service codes for hospitals, nursing homes, assisted living facilities. So telehealth too. And then we have the telehealth site locations. What is this all about? Site locations? Yeah, this is something that you're going to need to document in your notes if you're going to do telehealth. The originating site, where is the patient? You'll see when I go through a sample SOAP note, where is the patient? Are they at home? Are they in a hospital? Are they living with a relative? Are they in a nursing home? Where is your patient? And where are you? You're considered the distant site location. The patient is the originating, the distant is where the provider is located. Now, just back up, billing managers, you should be familiar with this. Typically, right, the originating site location does not include the home. Billing officer or billing manager or compliance officers, when you went through your training, you probably learned that. The home is not normally considered an original location, but because of the coronavirus outbreak, it is. It's under that 1135 waiver. And the distance site, where are you located, doctor? That has to be put in the notes. Are you in your home? Are you in your home office? There's a difference between a home and a home office. We'll get to that in a few minutes. Are you in your office? Where are you doing it? Are you doing it from, a hotel in Hawaii? Like, where are you? You have to put that in the notes. All right, so let's see. Okay, so here's the claim. So here's a few, I just threw out a whole bunch of different samples here. So you have your E&M codes. Yeah, if you're going to do therapeutic exercises, can you do therapy? There's another question, Dr. Kotler. I understand we cannot adjust a patient through the phone, but can we do rehab? Yes, I could do it. I mean, I don't know if you feel comfortable doing it or you have the capabilities, but I'm just a regular chiropractor. I feel very comfortable being able to provide therapeutic exercises through a HIPAA secure platform. So let's say you do that on the same day as a consultations, and then yeah, there's the example with the 9.5, the 25 and the 9.5. Yeah. So there have been some new diagnosis codes. Now we do also work with nurse practitioners. So nurse practitioners listening to this, there are some brand new diagnosis codes specifically related to COVID-19 for respiratory infections, pneumonia, upper respiratory, acute bronchitis, cough, R05, shortness of breath, R0602, fever, unspecified fever is R50.9. So you need to update your diagnosis codes if you're going to be dealing with this, with these conditions. Pregnancy, I mean, these are brand new. These just came out like a couple of days ago. That's why these webinars, every day I'm updating them. Talk about stress. Imagine being pregnant and finding out that you tested positive for corona. Wow, that's rough. Okay, number 4. Place of service 2 indicates telehealth. A, true, B, false. Place of service 2 indicates telehealth. A, true, B, false. All right, let's go through some health plans. This was nice. The other day, I logged in to the United Healthcare website. Boom, telehealth services for chiropractors. Wow, fantastic. Blue Cross Blue Shield of Minnesota, one of the first plans to come out and say, we'll pay if it's a new patient. Great. Blue Cross Blue Shield of New York. New Jersey, Governor Murphy signed an executive order requiring health insurance companies to pay for telehealth. Blue Cross Blue Shield of Illinois, one of the doctors I work with, submitted a claim for telehealth, got paid in less than a week. Blue Cross Blue Shield of North Carolina, Blue Cross Blue Shield of Rhode Island. One of the first health plans I noticed came out and said, we will pay chiropractors for telehealth. Nice. South Dakota, Cigna. Cigna has a whole bunch of things on telehealth. Cigna is kind of being different. That's why you need to call every plan and find out what the deal is with every plan. Cigna is saying, we don't want number 2 for telehealth. We don't want number 2. It's going to cause a system malfunction. It says due to, you see up top, it says virtual services may result in reduced payment or denied claims due to the current system limitations. And this is what we recommend you create. This is what we're doing for our clients. We're putting together the name of every payer, if they're paying for telehealth, what the place of service, what modifiers, how much they're going to pay, where to send the claims, what's waived, what's not waived, the links. So billing managers, compliance officers, start working on a insurance tracking. Here's the 1135 waiver. A lot of things are being changed because of this waiver. The health force is being expanded because of this. So let's say you are a nurse in Utah. You're a nurse in Utah, and you want to go to New York to help out. Federal government is saying they're going to take care of you. They're going to supply meals, laundry service, clothing, childcare services. A lot of unprecedented things going on. Number 5, you cannot inform your patients that you offer telehealth. You cannot inform your patients that you offer telehealth. A, true, B, false. More information that's coming out every day, getting more and more stuff. Not this one. Federal government is expanding and accelerating payments, advancing payments to providers. Next, you need to update your forms, your admin forms, financial forms, billing forms, SOAP notes. Here's the list, informed consent. So if you don't have malpractice, contact us. We'll send you our sample informed consent form. It's better than nothing. If you have a malpractice insurance company to talk to, get it from them. Update your HIPAA notice, update your intake forms, your insurance verification forms, your financial policies. Target coding members, we have these all updated for you. So contact us if you need them. Your SOAP notes, of course, your SOAP notes have to be different. There's a checklist here. Let me go through this checklist with you. First, the patient's name on the note, check. The date, check. That they initiated the telehealth visit, check. That they verbally agreed to be treated in this fashion, check. They signed your informed consent, check. They start telling you their complaints, check. You may need to go through some coronavirus screening procedures, like asking the patient, do you have a sore throat, fever, shortness of breath? Get their symptoms. Do an exam. What kind of an exam can you do through the phone, Dr. Kotler? Can you make an opinion on the patient's general appearance? Of course you can. Can you make a opinion and put it in your notes about the patient's mental assessment, like the patient appears oriented to time and place? This is all part of an exam. This is how you do a telehealth exam. Can you check posture? I can check a patient's posture through the phone. I'm sure you can too. Range of motion, muscle appearance. Now, if you're an AK doctor, you can't test a muscle through the phone, but can you look at the muscle appearance, soft tissue appearance? I could, if a patient says, Dr. Kotler, um, I was riding my bike the other day just to get out of the house to get some fresh air. I was riding my bike. I fell off my bike and I hurt my wrist really bad. Okay, Mr. Thompson, put your wrist up to the webcam and it looks 5 times the size of the other wrist. I can tell pretty quickly he's got swelling, he's got inflammation. I'm going to put that in the notes. Skin appearance, can you do a gait analysis? Abbreviated one. Mr. Williams, stand up. I want to see if you could stand up. You have severe back spasm, stand up. I want to see if you could just stand. Hold on to the chair. Can you lift one leg? There's a couple of simple gait analysis things, range of motion. I'm sure you could do that. Get a preliminary diagnosis, like, I don't know, spasm, swelling. Use ice, recommendations, heat, ice, rest, stretch. Follow-up visit needed. Give the patient the opportunity to ask questions, answer all the questions, check that off your list, put on your list to call 911 if necessary, write down the platform that was used, Zoom, Skype, start time, end time, total time, where you're located, sign the note, date the note, where are you located? Here's another thing. A lot of people are asking us this question, but it's not for us. This is a malpractice question. Dr. Kotler, do we have to put in every single SOAP note that we went through the screening protocols, asking the patient about, did they travel to and from a COVID-19 hotspot? Do they have fever, cough, shortness of breath, sore throat? Do you need to write that down in every visit? That's the question we were getting. It's not a target coding question. We specialize in billing and coding and HIPAA. This is a malpractice question. So contact your malpractice insurance company. I contacted a few. One of the owners of the malpractice insurance company got back to me and I asked him, are you recommending your clients, customers, I'm not sure what you call, to write down that they've gone through a screening procedure on every visit? You know what his answer was? I should have guessed this because I use it all the time. You know what he said to me? He said, Marty, if it wasn't written down, it didn't happen. So here, just a few action steps. Check with your state board if you can do telehealth. Can you cross state lines? Ask them. If you're licensed in Pennsylvania and you went to stay with friends and family in Virginia, can you do telehealth where you're located? Where's the patient located? The patient is in Oregon to be with friends and you're treating the patient. You're not licensed. Again, you heard what I said. Parity, find out about parity. Why should a medical doctor get paid more for a telehealth or e-visit than a chiropractor? Number two, again, you mentioned the malpractice. Three, think about what services would you want to provide? I can give you a list. Nutritional consultations, TENS, back braces. We have some clients, they're doing it already. They've sent their patients a little kit, balls, bands, a couple of tubing, and the patients are going to do rehab through telehealth. Start letting your patients know if you're going to do this. I mean, even if you don't want to do telehealth, you should tell your patients that you're here. You want to send them an email letting them know about some breathing exercises during this crisis. You want to send them a little reminder that you're available. You want to send them something to do with stretching, something to do with health and wellness, safety, wear gloves, mask. So I think, what happens if you don't get in touch with your patients at all? And then once the dust settles, the patient's like, my neck hurts. Are they going to forget about you? They're going to go somewhere else? Stay in touch with them. Liability wise, is by you not offering telehealth, is that considered abandonment? That's one of the questions we got. Boom, call your malpractice insurance company. I don't know. Workers' comp, PI patients, if you offer telehealth and the patients don't come in, is that going to be used against them? Interesting, right? In-office screening procedures, are you going through these with your staff, sanitizing the tables, having patients wait in their car? Here's a great resource. The World Federation of Chiropractic has some really good stuff on OSHA, safetyness. This is right from OSHA. How are you taking care of your employees? You have your CAs coming in. Are they wearing gloves? Are you having them wash their hands in between? Like, what are you doing? Don't ask us. Ask your consultant, ask your office manager. Of course, you could ask us. Clients, you could ask us. Go over appointment scheduling. Review the onboarding process. Who's going to be the command center? Once you start offering this, patients are going to be calling or emailing. Is your billing office manager going to be manning the phones? Are you going to have like I have one client, he has 14 associate chiropractors out of work right now. He wants to employ them. He's going to be assigning telehealth to one of these doctors to start. What's the process? Email? How is your staff? Are they logging in from home? Wait a second, you have to have a HIPAA secure website, a HIPAA secure portal there if you have staff logging in from home. Give your staff work to do. I have working with one office, they have 55 employees. Most of them are home. Give your staff work to do. Verification of coverage. Watch billing and coding videos. Get caught up on your CE credits. Now, for telehealth visits, yes, you could use Zoom, FaceTime, but try to convert to a HIPAA compliant platform and get a BAA ASAP. And there's also telehealth professional etiquette. How are you going to check your background? I've done a few of these with clients. They have stuff in the background that just doesn't look right. Comb your hair, look nice. I don't know, find, do a little, do a practice run. That's what we're doing with our clients. We're doing practice dry runs. I'm making believe I'm the patient, then I'm making believe I'm the doctor. We're doing that. Now, we're getting a lot of questions. Which platform do you want to use? There's free ones. The one that I like that is very robust is called patientpop.com. It's pretty popular. You might be using it right now. You just didn't know that they also offer telehealth platform. So here, Patient Pop, I like them. It's a funny name, right? Patientpop.com, very robust. You could do your notes right in the consultation while you're having the telehealth visit. You could do your notes right in there instead of transferring it to your EHR. I don't know, contact David Kim, get a demo. His email is david.kim@patientpop.com. His phone number is 831-236-8985. They will sign a BAA with you. It's a HIPAA compliant platform, so don't worry about that. Number 8, for e-visits, yes, you need to use an online portal, so check with your software company. Number 9, you got to check the policies on telehealth. I gave you a whole bunch there. Insurance companies are required to expand their coverage on telehealth benefits. Also, it'd be nice if you could verify coverage prior to billing. And number 10, now's the best time to catch up on target coding videos and webinars, get your CEUs out of the way. How much Netflix binge watching can you do? How many episodes of House Hunters can you watch? So we have a whole bunch of other telehealth webinars coming up. What we try and do every day, we call it Facebook Live at 5. Every day, Facebook at 5 p.m. Eastern. I give you an update on telehealth. So follow us on Facebook. Go to Facebook, search Marty Kotler, DC, become our friend, and you can see our live daily updates. Stay in touch with us. YouTube, go to YouTube, search Target Coding, subscribe to our channel. You'll see we have a whole bunch in there right now. I probably have about, not all on telehealth, but I think I have about 50 to 8, I think about 50 to 60 videos on YouTube right now. Some of them are from 2016. They're old, but there's a whole bunch of good stuff. Subscribe to our YouTube channel, Instagram. So here are just a few closing comments. Here's our email. Contact us. Email info@targetcoding.com. Website targetcoding.com. That's what I look like, just in case you don't know what I look like. Some people say, why don't you have your, why don't you do a live webcam? Do you really need to see me talking? There's my photo. What else? Telephone number, 1-800-270-7044. We have a HIPAA secure fax number. You want to send us a fax that has patient, PHI on it? 1-844-831-2347. Again, feel free to set up a free consultation about telehealth or any topic relating to billing, coding, documentation, Medicare, HIPAA. Free consultation, set it up. What else before we get to Q&A? Oh, we're already getting testimonials. This doctor said, I have attended 3 webinars on telehealth and Dr. Collar's was by far the most informative. Thank you. Thank you. That was a good one. Yeah, we offer many types of services besides webinars. One of the things we like to do is provide compliance programs, target coding compliance program. It includes the big 3, HIPAA, OIG, and OSHA. We do most of the heavy lifting. Our program, we look at our program like a Mercedes, a Bentley, a Rolls-Royce, a Ferrari. I like Hondas. I love Toyotas, but we don't sell those cars. It costs more. Our program costs more. It's probably the most expensive HIPAA program out there for chiropractors, but you get more than anyone else. There are free ones out there. There are some that you can get free through your state association. Contact your state association. Maybe they offer a free HIPAA program. Ours is different, so let us know. We have a lot of doctors. As I mentioned, HIPAA is mandatory. If you're an office manager or a billing officer and you don't have a HIPAA compliance program, speak to the doctor. Let him know. Dr. Marty Kotler at Target Coding says it's mandatory. It is. Start doing it. You want to work in a compliant culture of compliance, right? This is almost done. Because of the popularity and the demand and the interest in telehealth, we are putting together a program. It's called How to Start and Build a Telehealth Chiropractic Practice. We're going to have all the marketing, all the phone scripts, text scripts, sample website, sample emails, how much to charge, tracking sheets, billing, coding, intake forms, an a telehealth coding cheat sheet, all the sample notes for PI patients, TENS patients, back braces, nutritional consultations, rehab. We're going to do practice dry runs to make sure you know how to do this. CA boot camps. We've been doing this for over a year now. We also do credentialing. We do a lot of things you might not realize we do. We're not just the insurance webinar people. We do credentialing. We also have a new practitioner credentialing starter kit. My nephew just graduated chiropractic college 3 months ago. We had to get him all set up. We gave him a good fee. We gave him a reduced price. No, we didn't charge him at all. But yeah, we got him a PTAN number, an MPI number, a CAQH. We filled out all the forms for him, the 860, I'm sorry, the 855, the 460, the 538, all the forms. We got him credentialed. But, the rules are a little relaxed now. If you have to revalidate, you probably have another couple of months, but we could do that. We do this for very, very busy practices. Like I told you, one of our clients has 14 associate doctors. Another practice has 55 employees. And we have some offices. We have one office that is making $25 million a year, has, I think, 80 employees. who's in charge of tracking all of the doctor's CE credits? Who's in charge in that office of the credentialing, revalidation, reattesting? Who's in charge when a new doctor comes on board? So that's why offices like that, they outsource all that stuff to us. We have a lot all figured out through our documentation management program. And then we also do billing. We charge 7%. We will do your billing. We're very different. Again, what's unique, again, one of the things unique about target coding is everything is pretty much custom. You can go to a store and buy a suit right off the rack. That's fine. We don't sell custom. We don't sell off the rack. Everything's custom. Even our billing program, we customize it specifically for your type of practice. Are you in network, out of network, cash? Who's doing it? When are you doing it? What are your pay? Mostly PI? Are you mostly Medicare? If you're mostly PI and cash, don't call us. You don't need us. You don't need a billing company if you're all PI and cash. We've turned away probably 20 offices in the past few months. They're just not a candidate. But other billing companies might take you, but we don't take everyone. We also have our forms package. Our forms package now includes all the telehealth forms. Okay, so let's go and take a look and see what questions have come in. Again, I want to thank everybody for attending. We're going to go to Q&A right now. Here's my contact information.